Welcome to Mindful Movement for Back Pain. My name's Julia and I'm going to talk you through this short session for when you have back pain. I'm recommending that you do this session lying on your bed. If it's a double bed, lie towards one side of the bed. So maybe lying towards the right hand side of the bed, and I can talk you through the right left in that situation. So I'd like you to lie with your knees bent and your feet on the mattress, and just allow your knees to maybe touch together if that feels more comfortable for you, rather than holding them in a position where you create tension. Now this is all about letting go of the tension that sometimes can cause back pain. So you've overworked it, you've done some gardening, you've done some lifting. Sometimes we're not quite sure what's caused that back pain. But you wake up, it feels stiff and it's difficult for you to get out of bed. It's difficult for you to stand up comfortably. But you know that once you stand up comfortably and you start the walking process, you start doing these automatic movements, that it does release. Trust that it will release. But for now, what I'd like you to do is to bring your arms down by the side of your body and make a fist with each hand. Just have your thumb outside that fist. Now what we're going to do is we're going to put those fists underneath your lower back. So what you can do is you can tip your legs towards the left hand side, enough to enable you now to slide that right fist underneath your lower back, and just situate the fist just at the very top of your bottom cheek for the moment. Let your legs come back into the middle and you'll feel the weight settling down onto that right fist. And let your legs roll over to the right hand side now, sliding the left fist underneath the lower back. So the fists are slightly apart, they're either side of the back, they're around the areas you know your anatomy of, around your sacroiliac joints. And let the legs come back into the middle. Now your arms are kind of almost forming a frame around your ribs and your lower back, elbows bent comfortably. And what I'd like you to do now in that position is just take some easy breaths. Just be aware of your breath, where it comes in through your nose, letting your belly rise, letting your ribs rise, and allowing the area of your body that's touching your fist to just mould over your fist. Let it relax over, almost like it's a soft area, and it's stretching over your fists. Your weight will feel like it's coming more onto your tailbone. If you feel your back starts to react to that and it starts to pull, then just come back a little bit, just lifting your tailbone away from the mattress a little bit. And do that a couple of times, so just an easy breathing into your belly, breathing into your ribs, breathing into your head, creating some space for that tension to release, creating some space for that pain to dissolve away. Now after a minute or two, it becomes a bit uncomfortable on your fingers in this position. So rocking your legs over towards the left hand side again, spread your fingers out now so that you've got flat hands, palms down on the mattress, and bring the legs back. And letting your legs roll over to the right hand side now, spread the fingers of your left hand out so your palms are now flat, and bring your legs back into the middle. And repeat the breathing again, easy breathing. Repeat the pelvis just gently rocking the weight towards your tailbone. Breathing into your belly, breathing into your ribs, breathing up into your head, creating space for the tension to release, creating space for the pain to dissolve away. And the weight just gently coming towards your fingertips through the lower back. If your back reacts, just let the weight come more towards your wrists. And now just letting your legs just rock side to side. So your knees just point towards the wall on one side, not too far, quite a little movement. They point towards the ceiling as they come through the centre, and they point towards the other side. The weight will just rock on your feet a little bit, side to side, inside of one foot, outside of the other. Think of a very slow metronome, the thighs just tilting to one side and then the other, just creating that rocking sensation. And then you can repeat that sequence as many times as you need to, as many times as you've got the time to do. So what we did is we created the fist, maybe rocking the legs to one side to create the fist with one hand, rocking your legs to the other side to create the fist again. And allowing the back that's over the wrist to just melt over. Breathe into it. Breathe into your belly, breathe into your ribs, breathe into your head. We created a little bit more weight towards your tailbone, so it almost feels like you're pushing your fists up into your lower back. It's a nice, almost little massage feeling. And then when it becomes uncomfortable on your fingers, rock the legs to one side, releasing the fingertips out straight. Rock the legs to the other side, release the fingertips out straight. And just repeat the breathing, the gentle rocking of your pelvis, the gentle rocking of your legs side to side. And what we're looking for again is release. What we're looking for again is space. And then, when you're ready, just let the legs roll to one side again. Release the hands one at a time, letting the legs roll the other way to release the other hand. And either just keep your hands down by your side, maybe just hugging the very top of your thighs with your hands, or bringing your hands onto your abdomen if that's more comfortable for you. See if you can just bring your knees slightly apart. And then see if you can bring them apart so that your legs are in line with your hip joints. It just means you've got a little bit of space between your knees. Repeat the breathing, breathing into your belly, breathing into your ribs, creating space, creating release, and repeat the little rocking of the weight onto your tailbone, onto your waistband, without pulling, without pushing, without squeezing, just a very gentle rocking sensation, as if your fists were still there underneath your lower back. And again, you can repeat a little rocking of your legs side to side as well. So the breathing, the rocking of the pelvis, the tipping of the legs from one side to the other very slowly. And then we're going to have to move out of this position slowly. So if you're lying towards the right hand side of the bed, I want you to take your right arm out to the side in line with your shoulder, palm up. So your arm is at right angles to your body. Bring your feet and your knees together and lift your left arm up above your shoulder. Obviously, if you're lying on the left-hand side of the bed, it would be the other way around. But what we're going to do is we're going to roll over onto your right side. And we're going to use the weight of your arms and your legs to help you with that, because often that can be an issue when you're trying to roll over. Your back starts to feel stiff again, and we don't want to undo all the release that you've worked on so far. If you need to, just try rolling towards your right, and if your back starts to react, what you might want to do is just inch your feet further over towards your left, and then as your legs roll towards your right, let your left arm come with you as well, and just take your time to roll yourself over onto that right hand side. Press your left hand down into the mattress and use it to inch your bottom backwards, to inch your pelvis backwards. And hopefully you've got your head resting on a pillow that feels comfortable enough to take the weight of your head. I then want you to bring your knees up towards your chest, just a comfortable distance, or at least a right angle with your thighs, but you can bring them up a little bit higher if your back feels uncomfortable. And then in that position, your back will probably be gently rounded, And we're going to do the breathing again. So just breathing into your belly, breathing into your ribs, breathing all the way up into your head. Easy breaths in and out. Take your time, maybe a slightly longer breath out. Maybe just using that natural space in between your breath in and your breath out, so that you create a pause, you create a waiting for the breath to happen. And then the little rocking of your pelvis again. So it will feel like you had a tail and you were just tucking it between your thighs at the back. And then just gently sending that tailbone away from you. Don't make it a big movement, but let it just happen with ease. Think of this as just creating some movement in your back to release the tension, to relieve the pain, and as a basis for creating some normal movements that will eventually let that pain ease off. And again, like we did lying on your back, you can repeat the breathing, the rocking, as much as you want to. Okay, and pause this if you need to anywhere along the way. So if you're doing this at the middle of the day, you might feel that at this point that you'd like to close your eyes for a moment and pause if you want to do that. But I'm going to talk you through coming up now into standing. So you're going to inch yourself towards the edge of the bed by sliding your feet forward and using your left hand just a bit of pressure down into the mattress. Get to a point where you feel your feet are just tipping off the edge of the mattress, and then using some pressure down through your left hand, push yourself up onto your right elbow and stay there for a moment if you need to. And then when you're ready, start to press into that left hand again, pressing down through the right hand. Bring yourself up into sitting. And when you're in sitting, inch your bottom forward so that your feet are on the floor. Now it's a new position. So let's go back to the breathing again. So breathing into your belly, into your ribs. Create some space in your waist now. You have to support your torso into your head. You can have your hands on your thighs. You can have your hands on the mattress. You can have your feet wide. You can have your feet narrow. Repeat the breathing to create some release. Repeat the breathing to create some space. And then start to move your spine again. And in sitting, it will feel like you're slouching, just gently, and like your spine is growing tall. But thinking again of the pelvis just tilting back, slouching round, and inching or even millimetering that spine into an upright position without tensing. It's never bracing, bit by bit. And again, you can repeat this as much as you need to. You know when you get to a point where you feel that the tension is releasing, that the pain is dissipating, and that you're ready to stand up. Now to stand up, you might want to take your feet a little bit further back and lean your body forward with your weight on your thighs. And when you can, bringing the weight forward and lifting your bottom off the mattress. And what you might need to do is walk your hands up the front of your thighs to bring yourself into a standing position. Stand easy for a moment, feeling where the weight's going through your feet, maybe putting your hands on your waist area or into your lower back if you need some support. And just bend and straighten your knees. bend your knees, slouch over, straighten your knees, grow tall, but never bracing. Remember, good positioning is just always about creating a space to move away from, all about the movements. And give yourself a minute to feel relaxed and released in a standing position. Mimic the process of getting ready to take a step by letting the weight go through one foot and then the other. And then when you feel ready, allow yourself to take a step nice and light through your feet and another step, and maybe walk around the area that you're in first before you then get on with the rest of your day. I hope you enjoyed that session and that it's useful for you with how you're feeling today. And I look forward to doing another one with you very soon.